Have you ever tried to picture that jumble of things packed right between your lungs? It can be pretty confusing, right? Well, you're not alone. In this explainer, we're going to clear up one of the trickiest areas in anatomy, the mediastinum, and we're going to make it really simple.
So what are we even talking about when we say the space between the lungs? It's not just one thing, but more like a really crowded neighborhood of super important structures. So let's draw a map.
All right, let's get right to it. First things first, what is the mediastinum? Let's put a simple definition up so we're all on the same page. To put it as simply as possible, the mediastinum is the central partition in your chest. It's the entire space that's sandwiched right between your right and left lungs. You can almost think of it as the central hallway of the chest. This picture here shows it perfectly. See that central area? That's what we're talking about. And notice, it's not a single organ. It's a compartment, a space. And it's home to some of the most critical structures in the entire body, like your heart, your major blood vessels, and your windpipe. Now, to really understand the mediastinum, it helps to think of it as a three-dimensional box. So let's go ahead and build that box by defining its walls, its floor, and its ceiling. Okay, so here are the walls of our box. The front wall is your sternum, or breastbone. The back wall is your spine, the vertebral column. The floor is the diaphragm, and the ceiling is what we call the thoracic inlet. That's just the opening at the very top of your chest. Then, on either side, it's walled off by the lining of the lungs, the mediastinal pleura. There, now its location is perfectly defined. Okay, now that we've built our box, we need to organize all the stuff that's inside. So anatomists divide it into sections. The first, biggest division splits it into an upper part called the superior mediastinum and a lower part, the inferior mediastinum. So how do we make that division? Well, it's an imaginary line, a horizontal plane. And this line is a really critical landmark. It runs from the sternal angle, that's a little ridge you can actually feel on your breastbone, straight back to the T4 vertebra in your spine. Everything above this line is superior. Everything below it is inferior. Now let's zoom in on that lower section, the inferior mediastinum. This area is especially important because, well, it contains the heart. And because of that, it gets subdivided even further. We break this lower section into three parts, and it's all based on where they are in relation to the heart. It's actually really logical. The heart and its protective little sac, the pericardium, they make up the middle mediastinum. Then that small space in front of the heart, that's the anterior mediastinum. And the space behind the heart is the posterior mediastinum. Simple as that. So you might be wondering, why do we need to know all these little compartments? Well, in medicine, this is where it all becomes really, really important. When something goes wrong in this very crowded space, the symptoms can tell us exactly where the problem is. Think about it. Because all these vital structures are packed in there so tightly, any kind of tumor or swelling can start to squeeze them. And when that happens, it causes a predictable group of symptoms that we call mediastinal syndrome. And this is where knowing your anatomy really pays off. Each symptom points directly to a specific structure that's being compressed. If the superior vena cava gets squeezed, you'll see swelling in the face and arms. If the trachea, the windpipe, is being pressed on, the patient will have trouble breathing. Pressure on the esophagus, they'll have a hard time swallowing. It's like a clear roadmap that takes you from the symptom right back to the anatomy. Okay, for anyone studying for exams, this next part is for you. Let's wrap up with the absolute must-know high-yield facts that will really help you with revision. Now, trying to remember all the contents of the superior mediastinum for an exam, yeah, that can be a real challenge. That is where a good mnemonic becomes a lifesaver. Just remember, PVT left bat tet. This one simple phrase will help you lock in all 9 of these key structures so you're ready on test day. So let's do a quick final recap. The mediastinum is the central space in your chest. Remember, not an organ itself. It's divided into a superior part and an inferior part. And that inferior part is then split again into anterior, middle, and posterior sections, all based on the heart's location. If you can master these divisions, you'll have a really powerful key for understanding both anatomy and clinical problems.